In modern medicine, technology is crucial. We often hear about groundbreaking surgeries and life-saving treatments. But behind the scenes, data standards like DICOM and HL7 are the silent heroes. DICOM stands for Digital Imaging and Communications in Medicine. HL7 stands for Health Level 7 International. DICOM ensures that medical images like X-rays and MRIs are stored and shared securely. HL7 enables the exchange of crucial patient information within electronic health records, or EHRs. Without these standards, doctors would struggle to share medical images, leading to delays in diagnosis and treatment. Thankfully, DICOM and HL7 exist, revolutionizing healthcare. These standards are the backbone of modern healthcare, facilitating communication and collaboration among medical professionals and systems. Medical imaging is vital for diagnosing and treating various conditions. From X-rays to MRIs, these images provide doctors with a window into the human body. But what good are these images if they cannot be easily shared and interpreted? This is where DICOM comes in. DICOM is more than just a format for storing medical images. It's a universal language that allows different imaging devices and systems to communicate seamlessly. Regardless of the brand of X-ray machine or MRI scanner, DICOM ensures compatibility. DICOM also ensures that medical images are stored securely and efficiently. DICOM files contain not only the image data but also important metadata, such as patient demographics and study information. This metadata is crucial for accurate interpretation and ensures that images are always linked to the correct patient record. By standardizing medical image management, DICOM has paved the way for more efficient workflows and better patient care. In today's digital age, patient information is no longer confined to paper charts. Electronic health records, or EHRs, offer a centralized view of a patient's medical history. For EHRs to be effective, they need to communicate seamlessly. This is where HL7 steps in. HL7 enables the exchange of clinical and administrative data between different healthcare systems. It acts as a translator, allowing disparate systems to share information effortlessly. By adhering to HL7 rules, healthcare providers ensure accurate and secure data exchange. With HL7, doctors can access critical patient information from anywhere, facilitating faster diagnoses and improved patient outcomes. Section 4. Bridging the gap. How DICOM and HL7 work together. While DICOM and HL7 serve distinct purposes, their integration is crucial for seamless healthcare delivery. Imagine a patient arriving at the hospital for a CT scan. The CT scanner, using DICOM, captures detailed images of the patient's internal structures. But these images alone don't tell the whole story. Doctors need context, such as the patient's medical history, allergies, and current medications. By integrating HL7 with DICOM, healthcare providers can link medical images with the corresponding patient information stored in the EHR. This integration enables faster diagnoses, more accurate treatment plans, and reduced risk of errors. For example, a patient's history of adverse reactions to certain contrast agents would be readily available to the radiologist. DICOM and HL7 integration is about improving patient safety and outcomes. Section 5. Real-world impact, efficiency, and accuracy in healthcare. The integration of DICOM and HL7 is making a real difference in healthcare facilities worldwide. Hospitals and clinics are experiencing tangible benefits, from increased efficiency to improved patient care. One significant impact is the streamlining of clinical workflows. With seamless access to both medical images and patient information, doctors can make faster and more informed decisions. This translates to reduced waiting times for patients and more timely treatment. Moreover, the integration minimizes the risk of errors by automatically linking medical images with the correct patient record. In critical care settings, this increased accuracy is crucial for making life-saving decisions. Section 6. The future of healthcare, DICOM and HL7's enduring legacy. As technology evolves, the importance of data standards like DICOM and HL7 will continue to grow. These standards are essential building blocks for the future of healthcare. Imagine a world where medical images and patient information are seamlessly shared across different healthcare systems. Doctors could access a patient's complete medical history from anywhere, facilitating cross-border consultations and telemedicine. The integration of AI and machine learning in healthcare relies heavily on standardized data. DICOM and HL7 provide the foundation for this data-driven revolution. Their integration is transforming healthcare, making it more efficient, accurate, and patient-centered.